more than 70% of the Singapore populations. So when we achieve that level, we will change our strategy to actually living with COVID-19. So countries around the regions can actually take reference to Singapore when things become better control in the countries, when your vaccination rate has become higher from above 50%. So we have actually come down with certain strategy of how to live with COVID-19. So booster shots, booster dose can be an annual possibility. And also we are looking at better treatment strategy and availability for our populations. And we also look at how we work, your offices, your buildings. We have to do some kind of modifications to the ventilation systems. And we also have to relook at our working pattern and education system. So this is how to live with COVID-19, probably for Vietnam, maybe at the end of the year or early next year, based on the current vaccination rate. So Delta variant has come out a lot in media recently. I mean, that is rightly so, because it has really changed the whole strategy against COVID-19. A lot of the current, if not most of the current batch of vaccines are actually designed based on the wild type, which is the original COVID-19 strain that was first discovered in Wuhan, China. And since then, there were multiple new strains. There were the Beta, and then now we have this Delta from India. And the Delta to date is one of the most infectious one. All right, so there was some mutation as a spike protein, and as a result of that, it is now more contagious, more easily spread to other people. I mean, to quantify it, the strain from China initially can spread to 1 to 2. For Delta average, it can spread to 3 to 4. I mean, in some situations, it can spread even more than 4. So it is also 50% more contagious than the UK strain or the Alpha strain. And there was also a study done in China regarding Delta. They found that people who were infected with Delta strain, there were at least 1,000 times more in terms of the quantity of virus in their nose. So this has demonstrated the potency of the virus, the Delta strain, in terms of spreading to other people. And it is also a cause of concern, because people who are vaccinated is also, if they are infected with Delta strain, they're also more likely to spread the virus to other people, which is not the case for the original strain of COVID-19. And also another point of concern is Delta strain is also more likely to lead to death and also hospitalizations, especially among the unvaccinated people. And this is actually based on a study published in The Lancet recently. Okay, vaccine hesitancy. So the main purpose of my sharing today is so that I can address all your concerns, your worries, so that I can remove the vaccine hesitancy, and then you go for the shots. So we can see over here, over time from December to May, when the number of cases rise in most Southeast Asia countries, people also change their attitude towards the vaccine. They are actually more receptive to taking the vaccine. So you can see Vietnam from here up to here. So which is a good sign, means more people are willing to go for the vaccines. So this whole pandemic again has shown that we live in a global village, right? The world is flat, which is very true. So pandemic, global warming is actually a reminder that we all share the same space, share the same environment. And COVID-19 is in fact not the first emerging virus that has a big impact. If we look at the past 20 over years, a lot of new viruses came out: Nipah virus, Ebola, MERS-CoV, SARS, the Middle East, MERS-CoV, the Middle East, and then we have other like Zika virus. So all this is actually a trend that we need to take note of, especially those in the government sector, also those in the private sector, in the insurance space. So this will only become more common. And there is this term, we call it the disease X. Basically, it's unknown disease. There's yet to affect, yet to hit the human populations, it could potentially be more lethal or more infectious compared to COVID-19. So the question is, are we ready to face this disease X? So I want to bring this concept to you so that you are aware that we all live in the same environment, we share the same space, and not just you, we share the same space with fellow human beings, with our animals, with the plants. So everything is linked, everything is connected. So if the animal is sick, it can transmit to humans. If human is sick, human can transmit to the animals. If the environment is not being taken care of, it will affect the health of the whole ecosystem. So this is very important when we look at not just pandemic, but also things like global warming, which is really hitting us quite frequently, quite hard right now. Now, I'll move on to the next phase of my sharing, which is about the COVID-19 vaccines update. You can see here there are the 6 different types of vaccines commonly used in different countries in the world. The Pfizer, Moderna, the same class of mRNA vaccines. We have the AstraZeneca and Johnson & Johnson. They are, and the Sputnik V as well. They're actually the same categories, the vector viral type of vaccines. And then we have the one from China, which is the attenuated type of vaccines, the Sinovac. So yes, vaccine is very, very important, especially right now when things are almost kind of like out of control because of the Delta variant. But just bear in mind, vaccine is not the answer for everything, okay? Vaccine is not the panacea, okay? But vaccine is a very important strategy against COVID-19 pandemic. So just a few days ago, because of the rapid rise in the COVID-19 cases in United States, the USA CDC has actually announced that people who are in quite a number of states, if they are indoor, even if they are vaccinated, they are also required to wear face masks. Because as I mentioned, Delta strain is very strong. It can affect the vaccinated people, and not just that, it can also spread from vaccinated people to other people. So now, from without the need of wearing face masks indoor, outdoor, now the CDC has actually mandated people in many states in the US to start wearing face masks again when they are indoor. So it just shows that the importance of other disease control measures besides vaccines, right? So mask wearing, hand washing, social distancing, all are very important. If you are sick, just stay home, don't go out, right? Don't go to your office to reduce the risk of exposure for your colleagues. So all together, we need all these different steps for us to win the war against COVID-19. So 4 types of vaccines. I'm sure you guys are very familiar with the Pfizer vaccines, the Moderna vaccines. They are the mRNA vaccines. They actually use a spike protein from the virus and then trigger an immune response in your body. And the Sinovac is the one that's using a deactivated form of the virus, or the whole virus method. This is quite an old and established technology we use in many of our current vaccines. So this is a Sinovac, and then we have a protein subunit. This is a Novavax. It's not very commonly used in Asia. So mRNA, and the last one is the non-replicating viral vector. So this is used in AstraZeneca, in the Sputnik V, the Russia vaccines, and also the Johnson & Johnson vaccines. So this is illustrations of how the mRNA vaccines actually triggered an immune response in you. So many people are worried about, okay, because they use the mRNA, is it possibilities that it might change my DNA because the vaccines is mRNA vaccines? The fact is, the answer is no. It won't change your DNA. So mRNA will just stay outside the nucleus of the cell. It won't go inside, your nucleus and change your DNA. So you don't have to worry about that. I will share with you about the efficacy So you can see the efficacy, the percentage is actually based on the strain first discovered in Wuhan. It's actually not based on the Delta strain. I'll share with you the latest updates regarding the efficacy towards the Delta strain. So most of the vaccine are 2 doses. Only the Johnson & Johnson is 1 dose. And so you can see the example of vaccines over here. I'm sure you have heard or you have read this somewhere. And efficacy is actually affected by the age, the type of the virus, and also the host capacity to mount immune response. So for Sinovac, it's actually used quite a lot in developing countries. The issue with Sinovac is the efficacy for the clinical trials is actually is quite a wide spectrum, okay, from 50 to 91. As I mentioned, it depends. So this 50% was actually conducted in Brazil among the healthcare workers. So Brazil, as we all know, had a very severe, a very serious outbreak. And this study was done among the people who work in a hospital. So naturally means they have higher exposure to the virus. Just like what happens in Indonesia right now, we see a lot of people at the front line vaccinated with Sinovac actually came down with the symptoms. But the good thing is, although they develop the symptoms, is still very, very effective in terms of severe disease prevention. So when you look at all these percentage, what does it mean? It basically means the chances of you developing symptoms, right? So it's just like the flu vaccines, the annual flu vaccine. Annual flu vaccines, it doesn't prevent you from getting flu vaccines, okay? It actually reduce the risk of you getting the disease. And if you do get the disease, if you do get the flu, you will actually suffer a milder type of flu symptoms or flu disease as compared to someone who is not vaccinated with the flu vaccine. So it's the same for the COVID-19 vaccine as well. So the higher the number means the lesser chance of you, developing the symptoms, developing the COVID-19 symptoms. So this is just measuring the symptoms. It is not actually measuring how good it is in terms of preventing death, how good it is in terms of preventing hospitalization. So the Sinovac is actually quite a good demonstration. The efficacy is a wide range, right, from 50 plus to 90%, and yet in some studies, quite a number of studies, they actually show very high efficacies, almost 100% at preventing severe infections and death. So this Novavax and mRNA, as we all know, they are very effective, very high efficacy, 90 to 95%, almost 100% at preventing hospitalization and death. And as for other vaccines, Oxford, AstraZeneca, 70%, J&J 66%. The Sputnik V is as high as mRNA, and this is actually published in a very good peer-reviewed journal. Yeah. So just a quick one. I know a lot of people will be questioning, well, mRNA vaccines, they are very effective, but this is the first time this technology is being applied in the general populations. So is it safe? I mean, that is a fair question to ask. I just want to mention that actually the mRNA vaccine is not something new to us. The scientists has actually started research on mRNA vaccines technology since the 1980s, so it's more than 30 years. And many studies have been conducted for the vaccines. And also coronavirus is not something new to us. SARS is a coronavirus. Human populations came to know about coronavirus since the 1960s. So they are not stranger to coronavirus. So we know coronavirus quite well. And since then, we also have developed multiple different types of advanced technology, and the vaccines were able to develop so fast because of the government and private sector came together, and help each other out, the financial support, and also because it is a pandemic, it's very easy to find participants, and so there are many layers of safeguards that are in place to ensure that the vaccines is safe. And the FDA, MHRA, a lot of regulators are actively tracking the data, which I'll show you later. Now, today we have seen more than 4 billion of COVID-19 vaccine doses being administered to the human population in different parts of the world. So this is a latest data on 29th July. So you can see here, darker greens means higher rate. The sad truth is the highest rates are basically limited to countries they are richer. You can see here the Western countries, whereas the developing countries, especially countries in Africa, they have very, very low rate of vaccinations. If you can see, if you can see the graph here, the chart. So only about the least wealthy 50 countries only have 2.1% of the vaccinations, right? You see this big populations of the world have actually received very, very little vaccines, whereas the wealthy country have actually overly represented, right? Their population is like this for US, and yet they have a very high percentage of vaccination as compared to the least wealthy countries. Over here is also another graph to show you. Yeah, so this is something that WHO is currently working very diligently to address, and the Vietnamese government as well. I think there is actually a victim of your own success in a way, because the Vietnam's government were very, very effective in terms of controlling the outbreak last year. So the number of cases remain very, very low. I think in a way that has actually give them a false confidence, all right, become complacent. So they really were not really actively seeking the vaccines in a way. And who knows, right? I think if the Delta strain did not come out, maybe the strategy will work, but no one can predict. Now we have this Delta strain that is very, very infectious and potent, and it's really disrupting all the government's COVID-19 strategy. So, but the thing is, the government has actually working very hard, making deals with multiple governments, even with the China government as well, to bring in vaccines to the country. So right now, based on the effort by the government, they have actually secured more than 170 million of doses for the population in Vietnam. So all these doses will be delivered, unfortunately, by the end of this year. That's the timeline. So that means right now it is very, very important for everyone to abide by the strict SOP to control the outbreak in Vietnam. So some real-world data on vaccine effectiveness. So what I've shown you in the table just now, it was the efficacy, right? Effectiveness under clinical trial or control environments. So what's more important, more valuable is the data that we're able to obtain from the real world. So better tested data. So over here, you can see this is the data actually pre-Delta strain, right? Pre-Delta variant, before the Delta variant came to become the dominant strain. So it showed very effective preventions in terms of disease. You can see data from Israel for those above the 60 years old, the high-risk group, more than 90% decrease in infections after 2 doses, almost 100% decrease in symptomatic cases after 2 doses, and also almost 100% decrease in severe cases and hospitalization. So the same result was replicated in UK, in Scotland, not just with Pfizer, but with AstraZeneca vaccines. You can see very effective in terms of preventing hospitalizations, and also especially in those above 80 years old as well. And the same thing was observed in the United States as well. So even if just 1 dose of vaccine has been shown to be effective in bringing down the infections and also increasing the amount of neutralizing antibody which is required to actually protect you against the virus. So even with one dose, we can see the effect. Now, what about the common side effect? So like every medications, that there is the side effect, right? I mean, same with COVID-19 as well. And the side effect is actually very similar to your annual flu vaccines. It might be a little bit more profound, but generally it is very similar to the flu vaccines, and it is more prominent in the second dose as compared to the first dose. And you can see from the charts here which one are the most common to the least common. Okay, so the most common is the pain around the injection site, feeling tired, muscle pain. Some people suffer from fever as well, fever and chills. Sometimes you feel nausea as well. And some people feel headache as well. Some cases, they experience swelling. So in general, you can see second dose is more profound compared to the first dose. Now, there's also another concern regarding anaphylaxis. So this is a valid concern, especially for the mRNA vaccines, the Pfizer and Moderna vaccines. Yes, anaphylaxis happened. In fact, it actually happened to one of my friends in Singapore. So she developed the anaphylaxis reactions about 20 minutes after she received the first jab. And then she developed some breathing difficulty. So she was actually under monitoring. So we had this protocol in Singapore. When you go to a vaccination center, after you receive your vaccines, you have to wait in the center for at least 30 minutes for observations. Yeah, so she developed anaphylaxis during that time under observation. So she was given, she was given a shots, and she actually recovered, but she was actually put in ICU for a few days under observations. All right, so some people might thought, why I bring up these stories, you know, it might cause fear in some of you, but I think we need to look at things into in perspective. So I'm not trying to sugarcoat everything. Yes, anaphylaxis does happen. Anaphylaxis is not fatal reactions, and we have medications we can give you, we can administer to remove to remove anaphylaxis, to treat you. So this is not a fatal reaction. In fact, it is reversible. So you feel back to normal, you know, after a few days. Okay, so it happens in the COVID-19 vaccines. But if you put things into perspective, if we compare it to other, you know, other interventions, other vaccines, especially the flu vaccines, actually it is not that bad. In fact, it can be even better compared to the flu vaccines. I have the data here, as you can see, for the Pfizer, for the Moderna, the number is very low. It's between 2 to 2.8. As compared to the flu vaccines, it can be up to 11.1. So in fact, the conclusion that you can draw is actually safer in terms of anaphylaxis reactions. Even for AstraZeneca, it is still below the higher range of the flu vaccines, 11.1. So you can draw the same conclusion as well. And for most of the, if not all the anaphylaxis reactions, it actually happen within an hour after the injections. So we have a protocol of 30 minutes. In fact, in Singapore, especially the elderly populations, quite a number of them were worried about anaphylaxis. So they actually stay on in the center for up to half a day. Some even stay there for 1 day, just to make sure that, you know, nothing happened, and they have their peace of mind. And we can reassure them this is an option for them. If they want to stay for the entire day, they are welcome to stay. We have a corner for them. At the end of the day, it's all about them getting vaccinated. And I will share a little bit more about this side effects regarding AstraZeneca and sort of Johnson vaccines. Is widely reported in the media, but sometimes the media, they have to sell the news. So they do have to report on rare occasions. They have to put a lot of emphasis on the rare events. So for the case of COVID-19 vaccines, that would be the side effect, especially the severe side effects. So the blood clots So again, we put this into perspective. You can see from the figure here, it is actually a very, very low percentage for you to get the blood clot from AstraZeneca vaccines. In fact, getting infected with COVID-19 actually increase your risk of developing blood clots in your body up to 16.5%. So one thing about the coronavirus, this SARS-CoV-2 virus, this COVID-19 virus is, it is quite a strong virus, especially now with the Delta variants. It can affect almost every part of your body, your brains, your heart, your lungs. It can cause you to have blood clots, and even it can cause you to have the long COVID, where you continue to suffer from symptoms 6 months after infected with COVID. So that's why it's very important to be vaccinated. And being pregnant also has the risk. Smoking, in fact, the risk of developing blood clot taking vaccine is lower than pregnancy and smoking. So some of the symptoms you can get from blood clots is such as headaches, blurry visions, tummy pain. So those who actually have a history of blood clot in the brain, they cannot and they should not take the vaccines. And those who have this thing called heparin-induced thrombocytopenia is basically a type of conditions caused by these medicines, heparin. They are also not suitable for vaccines, okay? But there are other vaccines that can take, Sinovac, Moderna, Pfizer. Okay, so now I just want to share with you about Delta variants. So Delta variant is really the game changer that changes everything, almost everything. So Israel, it's a very good case study. So Israel actually, they secured deal with Pfizer very early on. So they received a lot of Pfizer vaccines very early on, as compared to the rest of the world. They are the champion, right? They are the champion in terms of vaccination rate. So countries, scientists, they look to Israel, for clue, for guidance in terms of how they react, how they should reopen their economy, what are the measures to be in place when the population vaccination rate has reached 60%, 70%. Okay, so if you see the vaccination rate here, it is actually very, very high. So about close to 6 million. So that's about 70%, more than 70% of the population's vaccinated. That is very fast. If you can see from the 1st of January, they achieved the status in less than half a year. Okay, in less than half a year, you can see. So you can see you can see here the okay, you can see here the effect of the vaccines, right? It has brought down the number of cases. So holding everything in constant, okay, keeping everything else the same, just by giving vaccines to your populations, you can bring down the rate very fast, very nicely. The infection rate came down very nicely, right, until April 10th. So April 10 is somewhere here. So it's very nice. As the rate go up, vaccination rate go up, the infection rate come down. Very beautiful. And over here as well, the death normally lag about a few weeks. You see the effect later. So it is also very obvious it's coming down. All right. However, you can see a spike here. Okay. So the daily new cases was hovering less than 100 cases, but you can see now it is more than 2,000. So what happens, right? Everything was the same, still the same high vaccination rate, and yet suddenly we have a surge in the number of cases. So this is actually because of the Delta strain. So the Delta strain has also caused a spike in terms of the hospitalization. So I mentioned to you, Delta strain is more easily to spread and also cause more severe infections. So that brings me to the efficacy or effectiveness. I would say I'll put effectiveness against the Delta variant. so this is, I just want to highlight that these are very dynamic. It's a very dynamic situation. It's very fast evolving. So the data that you see here, it will change. Definitely, it will change. So based on the data from UK, for Pfizer, it actually become 88% against the disease, 96 against hospitalizations. But to be honest, we have to look at the Israel data because because UK, quite a big part of the population that receive the AstraZeneca vaccines, not the Pfizer, whereas for Israel, it's almost all from the mRNA vaccines. So from the Israel data, we can see there is a significant drop, of the effectiveness, right? From more than 90%, now it's only like 40% against the Delta variant. But the good news is it is still effective against hospitalizations and against severe disease. So Pfizer just came out with their own study a few days ago, showed that actually after 5 to 6 months, the vaccine efficacy dropped about 84%. But we have to take this with a pinch of salt because this is Pfizer-funded studies. Of course, they want to sell more vaccines, bring in more revenue. So we will have to wait for more studies to be done in terms of the durations of the vaccine efficacy over time. Okay, so again, the UK data show the same effectiveness, but we can see there's a significant drops in terms of the AZ vaccines for Delta strain. For Sinovac, again, they have not published too data specifically for Delta variants. We can derive or draw conclusions based on the outbreak in Guangzhou a few months back. It was caused by a Delta strain. So, what happens was they found that none of those people vaccinated with Sinovac actually developed severe disease, right? Severe disease means disease that require ICU admissions. So which is good news for those who vaccinated with Sinovac. And actually, in fact, just yesterday, Israel has announced that they will actually start giving booster shots from 1st August for people above 60 years old who received their second shot more than 5 months ago, right? Which is quite consistent with this announcement by the Pfizer CEO. It is a good news for Israel, but it will be a bad news for the rest of the world. That would mean some other countries, the developing countries, might have to wait even longer for vaccines. So the Sinovac producer, Sinopharm, has also made similar announcement that they are looking at booster shots in order to boost their immunity against the Delta variant. Okay, so I've shared most of information about the vaccines. Now I'll just share some other questions people might have regarding COVID-19 infections or COVID-19 vaccines. So COVID-19 reinfection. So can you reinfected with COVID-19 again if you have infected in the past? So the answer is yes. You can be reinfected with COVID-19 again. So that is possible, but the odds is very, very low. So studies have been done in UK actually show that you are actually protected from the virus at least 5 months after infections. So there have also studies have also been done regarding these reinfections. It actually varies from people to people. So some people that found that their body can generate immunity, or that can also have the memory that actually protect them almost for the rest of their life, right? So it's a bit tricky. So some people maybe only 5 months, then after that they can be reinfected. But some people, their immunity can be so good, they are actually protected for the rest of their life. So this is still developing. We are still studying all these different cases. And the other thing about breakthrough infections. So breakthrough infections basically means people who receive the COVID-19 vaccines and then they infected with the virus and then they develop symptoms. Okay, so this is called breakthrough infection. So I have the definitions here. So one thing I wanted to note is the vaccines will only start to be effective in your body 14 days after you receive the vaccines. Okay, so that's 14 days. Now, US, one of the highest vaccination rate, they actually actively track people who actually develop infections after the COVID-19 vaccines, but they only track cases that they are serious, severe, like require hospitalizations or even death. Okay, so you have to look at this, right? So yes, vaccines is like seatbelt. Okay, so wearing a seatbelt doesn't mean that you won't get into accidents. You still can get into accidents, but seatbelt really protect you, from being thrown out into the car or this. So same goes with the COVID-19 vaccines. So if you look at the figure here, this is a figure based on more than 130 million or 135 million people in United States fully vaccinated. Okay, so based on this figure, they found that actually about 2,000, close to 3,000 actually developed COVID-19 infections and admitted into hospital. And out of those, 500 actually died. But actually, you have to look at this, you have to minus number. So out of these 2.8 K of hospitalizations, actually 654 is really not related to COVID-19. So it's about 2,000. And in terms of number of deaths, it's about 450. Okay, it's about 450. So it's 450 deaths out of 135 million people. So it is a very, very, very encouraging result. So really show that vaccines work in this case. And we know US had one of the highest mortality rates in the world for COVID-19. So really, this has really shown that vaccines protect you from hospitalizations and also from death. Okay. So another thing is about the mixing of vaccines. So there is a talk about, first dose AstraZeneca, second dose Pfizer. Actually, right now, we still do not have a lot of data about this, but we do approve mixing Pfizer and AstraZeneca. We are not so sure about other vaccines. So the approach is if you receive the first dose in, let's say, Pfizer, and for some reasons, you don't have access to Pfizer again, then we advise you to go for the second one within the same group, within the mRNA, which is Moderna. And if you are taking AstraZeneca, then maybe you can consider the Russia, the Sputnik V, or you can go for Johnson & Johnson. Only if you really don't have access to other medicine in the same category, in the same class, then you go for a different class. For example, Pfizer, then AstraZeneca, something like that. So studies are still being done to examine this. Okay, so this is the last part of my sharing. Just a quick one, who can and cannot take the vaccines. Of course, I want to emphasize again, this is a very dynamic situation. As we have more and more data, and then we will actually review our guidelines in terms of who can and cannot take the vaccines. And it actually also varies from countries to countries. So I would say this is data from Singapore and WHO. So Vietnam, I'm sure, have their own guidelines as well. So in Singapore, actually, almost everyone can take the vaccines unless you have allergy reactions to the vaccines. Right, then you cannot take. So not just any allergy reaction, the severe allergy reactions like the anaphylaxis, puffy eyes, puffy lips, difficulty in breathing, dizziness. Okay, so other people who cannot take the vaccines include people who are immunocompromised, people who are weak, transplant in the past, HIV infections, when their viral load is very low, people who are undergoing immunotherapy, people who who have platelets that's very low. If you have dengue fever, very serious dengue fever, then yeah, you might not be a candidate. If you have fever in the past 24 hours, then that's a no. If you are currently unwell, you have pneumonia, lung infection, all this, then you also need to wait when you recover and then take the vaccines. So people living with cancer, they can take the vaccines. Pregnancy, they can take the vaccines. Breastfeeding can take the vaccines as well. So all these can take the vaccines. So in Singapore, since June, we have also started vaccinating young people, 12 years old and above, with Pfizer vaccines. Then you might have you might ask, so what happened to those below 12 years old? Because with Delta variants, we have noticed there is actually a increase in infections among the children populations, and also increase in terms of the severity of the disease. So now studies are being done to look at vaccinating any like kids or infants 6 months and above. Yeah, so it is quite possible at the from the end of this year, US might start to vaccinate people who are 6 months and older in US. They might not start from 6 months and older, they might start from those below 12 years old, from 6 to 12, and then they'll bring it down to those above 6 months old. Okay, so that's all I have for you today. So thank you so much for your attention. Over to you, host.
Thank you, Dr. Matthew. We have 2 questions from the audience in the chat box. So we are waiting for you to answer their concern. Thank you.
Okay. Okay, so in in Vietnam, the initial vaccination was with AZ. The Germany government has recommended a second jab should be Moderna or Pfizer. So the scientific rationale and risks. For Pfizer, would you recommend 3 shots as has been discussed and suggested in a few countries? Okay. So for the mixing, of the vaccines is actually, again, it varies from countries to countries. In fact, if you look at the AstraZeneca, if you look at the AstraZeneca vaccines, because of the concerns about the blood clot, different countries has different recommendations. If you compare European countries, even within European countries, different countries have different recommendations, whether it should open to everyone or whether it should only open to those above 50, above 60, because the blood clots is actually more common for people who are below 50 years old and female. So the risk of blood clots in those above 50 years old is actually very minimal. So different countries have different recommendations. So the rationale behind this mixing of AstraZeneca and Moderna is basically to boost the neutralizing antibodies in your body. Essentially, the neutralizing antibodies is what matters when it comes to prevention of disease. When you are faced with the COVID-19 virus, it is the neutralizing antibodies that actually fight off against all these viruses. So yes, studies have shown actually if you mix AstraZeneca and the Pfizer vaccine, it has shown to actually able to elicit a stronger immune response in the host, thereby increasing the effectiveness of the vaccines in the host body. Yes, but again, it will be down to the accessibility of the vaccines. If you have access to both vaccines, then yes, go for it. I mean, if you have access to Pfizer only, that's even better because Pfizer, Moderna have shown better results. compared to AstraZeneca. So I show in my slides also. So this is currently the only combination mixture of vaccine that has been kind of approved because we have more data. As for the mixing of different type of vaccines, it is still currently under studies. Okay, and then for for the second questions, okay, the third shots. So I think I have also answered this in my presentations. So I want to highlight, right? I want to just emphasize this. This is not limited to vaccines only, because we only know this coronavirus, this SARS-CoV-2 virus for 1.5 years. We are still learning new stuff about the virus. So it is evolving. Okay, so every few weeks you have new information coming out all this. So same for the vaccine as well. So we don't know how long can the immunity last in a person. So when it first came out last year, late last year, early this year, the predictions was it will actually last for at least 1.5 years in the host body, the immunity. So 1.5 years, we are looking at 1.5 years. But just a few days ago, the Pfizer CEO, in their own studies, they say it start to drop to 80+% after 5 to 6 months. And in front of Delta variant, I think it will be lower. So generally, you shave off about 20% of the effectiveness of the vaccines when you face with the Delta variant. So that is a reality that we are facing right now. So the thoughts of the third dose is actually real. It's very real. If not for the Delta variant, it will not be so urgent, right, to talk about this third dose. We can talk about it maybe next year, but because of the Delta variant, it really changed the whole picture. And actually, not just Pfizer, even the Sinovac, the Sinovac has also actually shared that especially for Delta variants, they actually recommend a third dose, a booster dose. So based on the trend, I think we can also speculate that other vaccine manufacturers might also come out and say, we recommend a third dose or this. So again, it's a double-edged sword. That means countries who actually have very low vaccination rate, the developing countries, it might be a kick in the ass or in a tummy for them. Pardon my language. For them to receive, there will be a delay. Vaccines that are actually designed to be donated to developing countries now might be used internally for their own population. So it will actually cause a disruptions and delay for the whole world, right, to open up. So it's a bad news, right, for quite a lot of countries. Yeah, and the development is in the future is very likely that every year we might be looking at the annual injections of the COVID-19 vaccines. So it's very likely, and then it will become like a seasonal shots, like a seasonal flu shots. So the scientists will have to modify the vaccines, just like the flu vaccines. The scientists modify the flu vaccines on an annual basis to anticipate the next outbreak of the flu, the next flu outbreak for the year. So this is likely to happen for the COVID-19 as well. So this is something that I think we can just keep in mind and be prepared for in the future. Yeah.
Thank you, Dr. Matthew. So one other question. So after the vaccine dose, we support to have the side effect.
Yeah.
So the question is, after how many days we should consider to contact the medical support channel if the side effect still presenting?
Okay. Now, okay, so that's a very, very good question. It really depends on the type of vaccines that you receive. Okay. I will say, so I share with you the 4 major types, right? So the Novavax, I think I won't talk about Novavax because it's mainly in in US, and also I think Vietnam also very good. It's also developing your own vaccines that might become available end of this year. So right now the major one are the mRNA vaccine, the Pfizer, Moderna, and then the AstraZeneca, and maybe a small amount of Sinovac. So Sinovac, they're using the old technology. So far, there is not very like major report of side effects, right? So only the Pfizer and the AstraZeneca. So Pfizer actually in Singapore and also in US, recently they have found that there's very, very, very rare side effects, which is called the cardio myositis, right? Basically, it's an inflammations of the heart muscles, and this is more prominent, more common in young males, right? Those below 30 years old male. And the good news is it is normally not very severe, and it recover very fast and recover fully. Okay, as for the AstraZeneca, that one is the blood clots. So these two are the very rare side effects that you need to look out for. If you do develop any of those severe side effects, I'll share with you. I think when you go for the vaccines, depending on the vaccine they receive, they also let you know what are the side effects to look out for. So if you develop these very, 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 very rare side effects, then you should go straight to a hospital. Okay. Now, for almost everyone, you will experience the side effect that I showed you just now, fever, pain, all this. Normally, it goes away 3 to 4 days. Okay, fever. So in Singapore, normally we advise people to call us. They can actually call us anytime, right? Because people, when they feel fever, when they have fever, when they have a body ache, muscle pain, we advise them to take paracetamol. So they can talk to us. We can let them know, okay, you should take paracetamol. You should go and sleep, bed rest, drink more water, and we deliver medicine to them. All this. If they need a medical certificate, we can create for them. So they can just call us anytime. But if the symptoms persist, if your fever is more than 48 hours, then definitely you should give us a call. Then we can actually, we can go through all the different symptoms, side effect review, and then to see whether there's a need for you to go to a hospital, all this for a more thorough checkup or not. Yeah, so most of the symptoms, 3 to 4 days. If your fever is more than 3 hours, definitely call us. But in general, if you just, feel unwell, you don't have medications, you are not sure, you can just call us, and then we can just give you our best service and let you know what's the best thing to do. Yeah.
Thank you, Doctor. Hello, everyone. Do you have any question for Dr. Matthew? We saw another question, Doctor, from the chat box.
Oh, okay. Actually, okay, that's a good. Okay, wait. Okay, breastfeeding. So breastfeeding, whether vaccination for breastfeeding. There are many questions about vaccination for breastfeeding women. So according to doctor, this should be vaccinated or not. So if yes, would there be any effect on breast milk and baby? Okay. I cannot comment for like Sinovac, all this. I can definitely comment for Pfizer and Moderna. So we use these 2 vaccines in Singapore. So if you are currently pregnant, So if you are pregnant, you can take the vaccines. We actually recommend if you are pregnant, third trimester, okay, third trimester, then you can take the vaccines. If you are breastfeeding, 6 weeks after labor delivery, yes, you can go for the vaccines. If you are breastfeeding, you can also go for the vaccine. Now, whether there will be any effect on breast milk and baby. So based on the studies right now done in US, there is actually no effect in terms of breast milk and baby. But we also advise some patients, if you are breastfeeding, yes, go for the vaccines, and then just don't breastfeed your baby for 24 hours after that. Yeah, I have to caveat this. A lot of studies have been done on pregnant women, on breastfeeding, all this, but because we are talking about data for 6 months, so this is a decision based on the 6 months data, okay, and then we extrapolate, to the general population, all this. So this is what we make our decisions. This is based on 6 months data. And also animal studies. So I cannot say, well, for sure there will not be any effect on this. Based on all this limited data, animal studies, all this, there's actually no effect. But we also advise the mothers to actually stop breastfeeding for about 24 hours after they receive the vaccines. Yeah. So second question for exact vaccines. The second shot is advised to take 8 to 12 weeks. After the first one. So what if the second shot is available before or after this period? So this durations of when to go for the second dose is actually based on when the amount of neutralizing antibodies. All right, I mentioned just now the amount of neutralizing antibodies that can be generated after second shot. So what we want to happen, what we want to see is you go for the shot, you go for the shot at the timing where it can generate the maximum response in your body, the maximum number, the quantity of antibodies in your body. So then that is the perfect timing. Okay, so for exact actually is yes, between 2 to 3 months. They have found that the second dose is able to generate the maximum amount of response, the best response between 2 to 3 months. Well, if you can stick to 2 to 3 months, I would say yes, please go ahead. But if you cannot, if you don't have a choice, then you don't have a choice. Still go for it. You will still have very good immune response, right, after the second dose, but it might not be, as good compared to 8 to 12 weeks. But definitely, it is more than just receiving one dose. Yeah. Okay, so I think I've answered the question.
Okay, thank you, Dr. Matthew. I think that everybody they have no question anymore. So if you need any question and answer from the Dr. Matthew, you can email to us, and then we will send it back to Dr. Matthew for further assistance. Thank you, Dr. Matthew, and thank you everyone for joining to us today.
All right, thank you so much. Stay safe, everyone. Stay healthy. Thank you. Enjoy your weekend. Bye.
Bye, sir. Bye-bye.
Bye. Bye.